Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron. I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to prime health in life and business. Now, today you will learn that in a world where patients often feel unheard, today's guest, Dr. Chase Banks of Finish First Chiropractic Wellness, steps in as a guide, a professional advocate who brings clarity, confidence, and compassion back into the healing process. So I know you're going to be excited to learn more about that as I am. Before we jump into the episode, just a quick message from our sponsor, Grow Solutions, where health and wellness professionals discover how to double their impact and income without doubling their workload. So we kind of eliminate stressors in the business, such as new patient or client acquisitions, marketing and growth strategies. We try and reduce operational chaos with proven systems, frameworks, and SOPs. And we also help you understand which AI systems and agents to implement, because the robots are coming whether we like it or not. So if you've ever thought this or said it to yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we could be your solution. Just drop the word grow below, or either myself or a team member will reach out to you, or feel free to reach out to me on any platform. But you're here today to learn from Dr. Banks. So again, Dr. Banks, welcome to the Prime Health Podcast. Please tell us a little bit about yourself and what you do.
Well, thank you, Derek. I appreciate it. I've been practicing 17 years, and my primary focus is with our patients is really being their advocate. I have people that partner with me with some pretty serious health concerns and conditions. They'll typically come into chiropractic offices. A lot of it has a lot to do with is that I've grown accustomed to allowing patients to spend as much time with me as possible. Our traditional healthcare system doesn't allow for that. Primarily, when I first started my practice right out of chiropractic school was focus on sports nutrition and sports injuries. I'm also a CCSP provider as well. And I thought that's the direction that I really wanted to take my practice and everybody that was a part of it. It's obviously over the years, what our healthcare system has done, what COVID did, it's completely changed my practice. Every kind of 2 to 3 years, there's some type of adaptation that occurs. A lot of it is myself digging into new information, new data, new research, new therapies, things that are valid, things that have changed the way that we look and we model healthcare options. I've now brought all that into our practice. And it's first and foremost sitting down with people, finding out what their health history, their medical history, their personal history is about, what's really gotten them to where they are at this point in life. And then also kind of playing into what their current goals are and trying to build what's going to be efficacious for them, but also what they have time and really what is their pocketbook meet. I mean, you see these things online and some of these really big personalities and even some on the functional health side, some of these physicians and people that are on podcasts talk about these really grandiose types of therapies. Most people cannot afford them, nor do they have the schedule to maintain them. And so what I'm left to do is try to say, okay, you have the capability of doing this amount of positive things in your life based upon whatever work measures, life measures, family measures there are, and your finances are only capable of handling X, Y, Z. So what we try to do is find the most beneficial things that they can implement and track them through that implementation process. That's where the assessment and reassessment come in, not just, hey, we do a whole bunch of lab work and then we throw some things at it and see what sticks and come back in 6 months. Hardly anybody stays consistent with that because they really don't have any understanding. And plus, when you have some people who are walking out of an office and they're left spending hundreds and thousands of dollars, they want to know if it's going to be beneficial long term. Yeah. So we try to start with some very simple processes and approaches and then just continue to work with them like, again, advocating, getting them to understand the education of why they're doing what they're doing. And then that way they can see and feel and experience what they should be based upon what science and the literature tells us they should. So,
yeah. Sounds like a great place to see a doctor when they need it. So that's a good thing. I want to step back a little bit in time here. I always like to ask the question of, what was there a moment in your life, an episode that happened at some point in time that said, you know what, I need to go into healthcare as a choice for a career?
Even when I was in high school and middle school, I've always loved science. I got into lifting weights and training and eating a certain way. I'm from a very rural area of Tennessee. There was no education on any of that. So I was stuck, basically, this was before the internet, going to Walmart to the magazine aisle and picking up information and trying to learn from it. Obviously, looking back, there was a lot of marketing involved in that, but, certain kind of muscle and fitness magazines and sports magazines, and implementing some of those things into myself and see what worked, what didn't work. And then when I got to college, really learned about nutrition a little bit more. But what really drove me to want to be into healthcare is that I really thought when I was in high school that I wanted to go into traditional medicine. And believe it or not, I wanted to do anesthesia.
Oh, wow.
Pretty far removed from what I'm doing right now.
Absolutely.
And I was doing it for the wrong reasons. It was all because I knew how much money they made and feel like it would be a good career and that kind of stuff. And I did some in my senior year of college when I was still pre-med all the way through and fixing to take my MCAT. And I'm doing some rotations with different groups in Erlanger Hospital in Chattanooga. And I kind of saw some things in the OR that kind of led me to think that I'm not going to be able to leave work at work. If I saw something that happened, whether it was with my own hands that contributed to it or somebody responded negatively to anesthesia, I don't know if I could have walked away from that and then just gone home and been okay with it.
Yeah.
Hats off to the people that can. My personality can't. The compassion that I saw that was removed out of the OR for reasons, right? Because of the decisions they have to make. I just wasn't going to be able to do that and be a good doctor, or be a good dad at one point, a husband, whatever it was. I kind of went back to the drawing board my senior year and was like, what am I going to do? So I knew that I wanted to do something really with sports and I wanted to help people. Thought there for a second I'd be a coach and a teacher until I realized in the state of Tennessee, just the education system was not going to be for me. And so I went back to my chiropractor. I thought every chiropractor practiced the way that he did. And I had no clue that there was a variety of philosophies out there. I didn't know that there was different curriculums at different schools. And he kind of opened my eyes to, hey, if you want to practice this way, and he was very, very structural, I would say very scientific, medical based from a standpoint of decision making and what he told patients as far as what was going on with them. And so he kind of guided me to Houston, Texas chiropractic. That's where he went to school back in the late 60s, believe it or not.
Wow.
And so came here. I came at a really good time. It was right after Katrina. Some of the instructors that we had at TCC were very good at didactics, very good at clinically teaching what we would experience out in practice versus what was just in textbook, and enjoyed it. And again, I felt like that I walked away with a hands up on that didactic process, not on the business side. It's one thing that I feel like that my chiropractic school did not do a good job of preparing people for. And it's to again, that's why there's different philosophies out there. But like I said, came straight out of school, knew how I kind of wanted to practice, and then the rest is history. And I just tried to make sure that whatever's coming through our door, if I have the capability within my scope to help them, I will go to whatever means necessary to do that, and not let everybody come into the same treatment model, the exact same process. We don't do any program plans. Everything here is a la carte, service for service. We don't do treatment plans ahead of time. So it's basically all about the patient at that moment that they're here. And I feel like that for them to walk away from the services that they get, I want to make sure that they're never thinking about, because we run a cash-based practice, I never want them thinking about, well, that wasn't worth it. Mm. That's the last thing I want to cross their mind. I don't want them to think about the dollar amount. All the only thing that I want them to do is basically feel like they have a direction They have more, not just hope, but they have an understanding of where they can move forward from what they have experienced, whatever health concerns it is, in the previous experiences with other practitioners and traditional medicine, that they're in the place that's right for them. And if it's not here, I will do my best, personal responsibility to find them the provider that they need to be with.
Yeah. That's something that's missing too often in all realms of healthcare.
Mm-hmm.
I've worked with orthopedic surgeons, in a practice with an orthopedic surgeon. I've worked with physical medicine rehab doctors in a practice with them. My wife was a physical therapist. All the doctors, for the most part, were willing to say, okay, my number one thing is to do no harm. Second is to educate. Third is to get them better. And along the way, if you can't, it's okay when you can't, because the end goal is patient betterment. And your patient should love and appreciate you more. If you can't get them better, you send them off to somebody that can. They should love you for that purpose. And too many people in healthcare are afraid to lose a patient because of the money versus what's better for them. So I can tell that your practice is filled with, ethics and integrity. So that's a good thing.
Yeah.
Yeah. So with your attitude that you took into practice there, kind of pushing back at that, I know you've got associates that work with you. Mm-hmm. It can't be easy to find people that fall into that same category. There's got to be some mentoring that goes along the way for that.
Absolutely. Finding people, I think I'm very fortunate that the most people that work for us have been with us for many, many years. I pride on the fact that our turnover is very minimal. Like, good. Office manager has been with me for 11 years. I've got one of my PTs. She's been with me for 14. Wow. Most of our other chiropractors have been with us now 6-7 years. And so the only chiropractors that have left due to family reasons. They were either from out of state, had a child, wanted to get closer to family so that they could have the support that they want and to be around that, which is, I completely understand. I have 4 little ones myself, and I have my in-laws that live 3 houses down. So I wouldn't want it any other way. So it's very important for that. So the point is that I pride myself on that. I will say there's a lot of I would love to say coaching that goes involved. I think that, I've worked my entire life by a specific model. What I do speaks so loudly that you can't hear what I'm saying. And that's probably what I try to promote the most with our other providers that work with us, is that they know what I stand for. They know how I live my life. They know what I expect in myself and what I do for our patients. And I want them to try to aim and try to achieve that themselves. Years ago, and I made the mistakes of this, is that I would expect people to see it the way that I do. This is my practice. I get that. And I hold it to a very high standard. And I realize that other people are not going to do that to that degree. I used to let it bother me. I used to let it eat at me. Why couldn't they, see it that way? Even kind of having discussions. But once you start to understand and respect for other people's differences of what their value structure is, like me, I value the quality of care that we give. I value the outcome. Some other people value their off time, their schedule or what they work really hard so that they can go take a really nice European vacation. Those are the things that they value for them. And it's just a difference of all that. However, when it comes down to having the team, everybody has to see life morality, certain decisions that they make for themselves and their family, very similar. I do practice with a good team of all believers, just that I am as well. And so it helps us tremendously to kind of guide ourselves with the decisions that we make, because we have a framework that we think off of. And so when I'm also interviewing for a potential new provider and associate, I'm asking them questions that let me know how their previous life was with their family, their parents, their siblings, if they have a significant other, if they have children, all those things take into consideration to my decision. I don't really care where they fell in their scaling of class, like if they're in the top 10% or anything like that. I don't care really what their skill set is on adjusting. That stuff is learned. I mean, what you get in school is very little to what you'll gain over the first 5 years in practice. And so it's, I always put it in the perspective that, I'm going to devote a lot of time, energy, money into somebody that we bring on. They have to have that value structure. Otherwise, I'm not going to invest into them because it would be a bad decision.
Yeah. Smart decision across the board, just for you, sanity wise, as you said, the values, and for patients. I mean, there's no better way to have that faith-based, which I think is great. In the practice, more people are leaning in that direction more and more, which is good. As we grow up, we realize that there is a stronger potential to need that behind us. So thanks for sharing that. I want to kind of ask a question about your tie-in of nutrition and athletics. So a lot of athletes, they think nutrition and athleticism is two different things. I think it's getting better now. People are getting in that way, but can you explain to us, or maybe in your belief, how does what people are eating affect their recovery from athletic injuries or chronic pain through your practice?
So obviously in Houston, this is a way different market than a lot of places in the country. Where I'm from, in Tennessee, if you work 41 hours, 42 hours, you're considered a workaholic. Here, if you work less than 50 hours, then you're probably lazy. And it's just the trickle-down effect of the energy sector. Well, the problem with that is that it leaves little time, because also, too, everything around here is 30 to 45 minutes away. Commute times, work, the amount of workload, all that kind of stuff makes a very, very small amount of time that you have to devote to preparation for meals, eating correctly, going to the grocery store, all those things that maybe you would have in different areas of the country. Like, I have patients all over the country that I do, remote work with, Zoom, that kind of stuff. And it's always amazing to see that how their capabilities of implementing healthy change versus here is a big difference. And so people really, truly in the Houston area really have to go out of their way to be healthy. So trying to teach people places, even they can grab and go and get things out of a window and how they manipulate it. The point is getting them to understand when they make those changes, the simple ones of their current schedule that they're already keeping. And we're going to kind of remove some of these pro-inflammatory things out of their diet. And then we say, okay, I want you to start recognizing, in this, especially when it comes to athletes, some type of biomeasure device. They don't have to, if they're a very kind of like compulsive person, I really try to steer them away from that. And then to just listen to their body as far as like when they wake up, do they feel more alert, more clear? Did they dream when they went to bed? How's their bowel movement consistency? How do they feel from a water retention standpoint? All those things based upon the changes that we recommended them make for their nutrition. And then they start to really get a buy-in. And that consistency is, again, I can get anybody to do anything for 3 months. I care more about their 2-year outcome than a 2 to 3 month outcome. And so if I can get them buy-in those first 3 or 4 or 5, 6 months, then at 8, 9, 10 months, if they're still doing those exact same things, they've got it. And they've made enough changes from a lifestyle perspective. But when it comes to nutrition, sometimes it's as simple as just like, hey, we're going to just remove these food groups for now. I want you to execute them over this next 30 days. And let's reevaluate how you're feeling, what you're doing, or what do we notice. I do a ton of blood work here. We do a lot of different assessments, high level testing. I even do MRT testing. I do food sensitivity testing. I do food intolerance testing, all different ones for different reasons. And yes, we will go all the way down to making a customized meal plan based upon all of those food intolerances and sensitivities or reactive foods. If it warrants itself. If I've got somebody that is just, they've never spent 5 minutes in their own kitchen, I'm not going to make them these customized meal plans that they have no idea. They don't have the time to sit there and go to the grocery store, buy all those ingredients, and now figure out how to cook for the first time in their life. It is so overwhelming to see that. So that's generally what those individuals were making. Hey, food group may eat this, not that. Maybe, hey, this is the restaurants. I want you to manipulate this menu. Take what they're currently doing and make it work for them. We have people that actually food prep for a lot of our patients. So I get those people involved. We have food prep services around the Houston area. I get those people involved. So yeah, really on the nutrition side, food is what I try to promote the most. And then when we get into obviously supplementation, homeopathics, things like that, that is like second, third tier of adding those in to kind of get a little bit higher up on the ladder. But if they can't do all that front end change, adapt and implement those food changes, I don't care what you do from a supplementation standpoint. You cannot supplant supplements in a diet. and think you're going to get near the effective change that you would with food alone.
Yeah.
So, that's especially on the functional side of healthcare. I think a lot of what I've seen over the last year or two, I have my own supplement company. I get it. It's a big margin. And so I feel like that a lot of people online have lost the sense of what you can do with nutrition alone. Mm-hmm. Unfortunately, in America, it is very hard to get good quality food. Mm-hmm. And so teaching people what those are, what to look out for, if they have time to go to farmers markets, if they have some like small farms supplying and that kind of stuff around the area, if there's certain grocery stores that supply them with obviously very good produce, we teach them.
It's interesting. Whole Foods is the way to go. I think it's getting more press on what to do. But you said a great point. It is difficult to get the good food that people need. And you spoke about how there's some practices that are out there that are just throwing a tremendous amount of supplements at people, testing them from here to the high heavens because it's a high margin component. Like if somebody comes into your practice, how do you decide which tests that they should have run versus a nutrition strategy that you outlay for them?
So we take into consideration everything that they've had done from a diagnostic standpoint. I'll go back 10 years, 15 years. I don't care. I've had people that literally have walked in here with a wheelbarrow, and I'm not joking. They have walked in here with a wheelbarrow worth of data, of notes, of lab work that they've done for whatever condition it was. And usually when I have patients that bring high load, they will bring it to my office manager or my team, my assistants. They will sit there and chronologically put it together for me. And then I will take additional time that they will have to pay for, and I will formulate questions. And I will go over all that before we actually sit down and do their initial encounter so that I can speed things up a little bit. So I will take into consideration labs. So, and this happens a lot, that I will have somebody that has gone to, and I'm not going to name names, a lot of these online companies, online personalities, some of our other doctors that do functional healthcare, and they bought into a $10,000 package, or they did $10,000 worth of labs, very similar to ones that I do. I will take that. If it's in the last 6 months and they're still dealing with the same things that they dealt with before they did these labs, I'll take a lot of that into consideration. Hormonally, a little different, especially when it comes to females. I will probably retest. I also test hormones at a specific time of the month for females, depending on whether we're trying to do things for fertility or we're looking at perimenopausal women, whatever it might be. But I'll take all that previous lab data and take it into consideration of what's necessary and what is the pertinent information that we can get from that. Then decide where are the holes. Is there holes in the clinical information that we're seeing that I've got questions about? I want to dig deeper into this. Why wasn't this followed up? I mean, I had a patient just last week that's been, had a GI map a year and a half ago, showed that low elastase levels, had some pancreatic insufficiencies that they were experiencing then, had some recent labs 2 months ago that showed elevated amylase and lipase, and nobody followed up on it. So their GI symptoms are very relative to what their findings are. So what we have to do is dig a little deeper, do some more follow-up. We're going to do some imaging, things like that. So the point is that it really is important, if you're going to be on the functional side of healthcare, that you take other people's work into consideration. I know it's hard, and I know it's like you want to probably make more money on, hey, I'm going to retest all this stuff. But I promise, if you can look at what's already done, what they've already spent money on, and show them that, hey, this is, you've already, it's not that you wasted money, but you already spent money on this. I'm not going to have you charge more money. And if they understand that you are concerned about their finances in a way that they just know that you care, you've got them in a way that the information that you start giving them and what you find out from them, it is a lot more valid, and it's a lot more, they feel like they're taken care of. As we know with all things, right? Faith, family, finances, all those things. If you've got security with that, you feel very content with where you are. And so if you can do it not only in your own homes, in your own businesses, but with your own patients. And if you can curtail that information to them and get it across to them that you're focused on those things, it really does help the outcome.
Yeah.
But yeah, I mean, it's definitely, it's a pick and choose. And I've had, business consultants and coaches that are patients of mine give me information along the way that I'm a little too hard headed. And I'm kind of like, there's a lot that you can mainstream a lot of this stuff and you can streamline it. And like I said, I was like, yes, I could. But I have people that don't really fit that mold that are coming in, and I want to make sure that I don't lose out on them as well.
Yeah. So I think in other practices, like you're saying, they will, when you walk in through my doors, I don't care what happened in the past. You'll tell me a little bit, but I'm not going to look into it. I'm going to look at my own little magic ball there. So it sounds like you have that as your first next step, but you will actually do some backlogging of what they've done. But like you were saying, they don't have to spend additional money, and a test is a test for the most part from one place or another. 6 months ago, of course, there'll be retesting that you may do, but I like how you take that approach of you did something in the past. Let's analyze that too. So that'll help us in the story that we produce going forward, and we'll add to it, which I think is great. I think that's great. So what do you think is falling short in mainstream medicine right now that people are missing out on that they can get in your practice?
Yeah, I think that's what I was kind of opening up, how COVID has changed our practice so much, is that prior to COVID, I've been doing what before it was called functional healthcare, before it was cool, right? Mm-hmm. But COVID turned it into a completely different patient that was coming in here. Prior to that, I had a lot of people that were already very fit, very healthy, or they're trying to do everything they could already to improve their longevity. Now I'm seeing a lot of sick folks that would be traditionally mainstream healthcare patients, not seeing someone like myself or somebody that's in the more conservative side of healthcare. These are people that are first stepping into this area of healthcare for the first time. And it's because they are frustrated, they're fed up, they are angry. They are tired of taking a pill every time that they go in. They don't want to get another prescription. They want to get off the prescriptions that they're on, but they're told that, no, you can't see me as a patient unless you do take these things. And giving them no other option, and realize that there is many other options. And sitting down, and I think what I'm seeing and what I feel like is falling through the cracks is, one, compassion. I think I think our traditional healthcare system at the education level, medical school, it's controlled by obviously a higher body of a very small amount of individuals that decide on what gets talked about and what gets studied. I think that the teaching of reducing compassion for the limits of liability is what the problem is, because I feel like that if you start getting everybody to understand the standard of care for a diagnosis, patient, whatever it might be, is this exact same thing for the last 1,000 patients with the same ICD-10 code, and you did the same, CPT code for that same patient 1,000 times over, as long as everybody else in the country is doing the exact same thing. Well, if you go to court, God forbid something happened to the patient, you do have there's some legality there that you have to basically defend yourself. If you did the exact same thing, that judge or whoever, the jury, whoever's basically deciding on that, is going to be like, well, hey, unfortunately, they responded negatively to care. They didn't do any negligence. There was no malfeasance or anything like that to that patient. And unfortunately, as we're finding out with obviously epigenomics and expression of genes, and especially our environment, people respond in a multitude of different ways, especially within one diagnosis and with specific treatments. And understanding the parameters of someone's life and their lifestyle and their own family genetics and personal medical history, you can treat someone 5 or 6 different ways and validate how you are treating them. Unfortunately, that validation takes a lot of time. If there was a case that was involved for the patient. So unfortunately, if a doctor has to validate why they treated this one specific concern 5 different ways, they're going to have to explain all the data, all the science, all the information 5 different ways to show that reason why they truly did what they did. And I just don't think that our healthcare system wants to do that because they're pressed on seeing as many people as possible. Because if you see as many people as possible and insurance says that it'll pay for this one thing this way, as long as that you run the numbers and code it that way, they're going to continue to do it. And they're not going to get in trouble, if something were to happen. And again, that comes down from high education level control, and then obviously our hospital systems. I'm seeing more. I will tell you, my private, and we have a very substantial network of medical doctors and DOs that refer patients to us. I feel very blessed in the fact that I have a network of traditional physicians that we co-manage a lot of patients with. They are mostly all private practice. Very rarely do I get a good personal and business relationship with a provider that is in a hospital system.
And that's unfortunate because they're great people. It's not to say that they're not, but it's not that they're not allowed to, but I'm sure it's very much frowned upon that, don't mingle with those that aren't in our network.
Right. And what it comes down to is that there's nothing wrong with those individuals. They unfortunately are left to they're having to deal with the hospital systems support staffs. There's tons of turnover because they don't pay their support staff. We're talking about it like assistants, some type of like MAs or anybody that's helping with the actual checking in, checking out patients, that kind of stuff. All that is a high turnover in medical assistants. And unfortunately, that carries over into the quality of care because people's frustrated because, their appointment gets, time gets told wrong or fallen through, or maybe they're sitting in the lobby for 3 hours and all that kind of stuff. But on the private side of practice, like some of one of my best neurosurgeons in Houston, he works for one of the most, I would say, conservative group of neurosurgeons. And I'll probably send him, I don't know, I would say every 5 patients I send him, he does surgery on one of them.
Oh, wow.
And he's a neurosurgeon, and I'm sending him because I think they need surgery. So the point is that because he's in private practice, he can sit down for an hour and explain to the patient why he thinks they don't need surgery. And that's something that carries over into, again, the repertoire of like when I'm managing that patient too, and they're getting a similar service here, then they feel like they're taken care of. So the point is that it's just, I think that the biggest downfall that I see in traditional sense of healthcare is the way that the standardization of care is going. And it is driven by liability risk. And that's where I think that's driving the patient to not feel like they're taken care of. And so those individuals are the ones that are coming in here wanting the education, wanting to know what they can do that's not being told to them, or what they're reading on the internet, right? They want to find out what's true, what's not, is it valid for them, that kind of stuff.
Yeah. I think the hospital systems are missing out on what the good that they could do versus being driven by bottom dollar, bottom line, the people at the corporate office that you have to answer to. That's not really what we were put out here. The days of the good old doctor that would come to your house with a doctor bag and that kind of stuff are gone for the most part. It's trying to resurge, but that's why people are seeking individuals like you and your practice help, because they know they can get a better result in there for that. So, which I think is great. Right. From your practice perspective, Dr. Banks, what are you focusing on right now in your business? Are you going in a certain avenue? Are you trying to grow in a certain way? What's your focus on for the business?
Yeah, we need to definitely do a second location. We have a bigger reach into the county that we're in. We're in a very large county just north of Houston called Montgomery County. We're on the southern portion of it. I need to get an office on the northern portion because of how much growth is out there. The county itself saw a 19% increase in population this year.
Wow.
Stated to get another 10% this year. And we just, it's hard for people that are, especially my youth sports athletes. I've seen them from lots of different high school systems or in school districts. And it's hard to, if I've got somebody that's got say one of my orthopedic surgeons referred a really high-end athlete that they feel like they need more hands-on PT here that's more specialized with our PT staff versus their PT. I can't expect that mother to check that kid out of school because it's 45 minutes away and they are going to be here for an hour and another 45 minutes back and try to get back to get the other kids out of school. It's just that logistics doesn't work. So we're going to have another location further northwest soon. I don't know. And I'm working on all of that. So that's a big part of, business planning, strategy, that kind of stuff. But it's also personnel. It goes back to the value structure of certain people and getting people that really want to work and not another startup, because obviously we have a pretty well-established name in the area. So it wouldn't take long to get us going, but it's definitely would take a little bit of time. I'd say like maybe 6 months. But then we're also looking at partnering with a couple other internal physician doctors with some pretty substantial therapies, HBOT being one of those, IV ozone, and then plasmapheresis. We see a lot of patients that require pretty substantial, let's say bloodletting or some type of cleansing, chelation at that, whatever you want to call it. And we have some people that don't have a lot of time. So giving them the option to do different therapies, of course, the cost there, obviously, based upon time is different. So we are looking at those units right now and possibly a facility that will be able to sustain that. And we're also looking at quantum frequency therapy too. So I know no one in the U.S. has really looked at, I know there's some people that have looked into that. There's a couple of units down in Central and South America that I've been in contact with the physicians, and there's some orthopedic surgeons that refer for that therapy, especially when you got people that they're too past the point of getting a replacement, or they don't qualify for surgery because of certain health concerns, and getting really good results with arthropathies, especially inflammatory arthropathy. So that's something that we've looked into too. But the problem is with that too is it's a lot of therapy that you have to do over a 30-day period. That's very expensive. Unit's very expensive. So yeah, there's some passive modalities that we're trying to decide, what are going to be the most utilized in this area, and kind of the ones that can be the most cost effective upfront. So
yeah, always looking out for your patient, which is a good thing. Very good thing. It's important, but you have to be frugal in expenses. It's got to pay for itself. You can't expect to take everything on your shoulders. And if you're looking at equipment, location, property, building, commercial, all that kind of stuff, it's all great. So, with faith, it's
going to require a lot of faith, because up to this point, the growing of this practice has been, it's definitely been like eating an elephant for sure, one little bite at a time, and a little bit of money here, reinvest back into this, invest into this person. It's a different story when you're looking at some of these other pieces of equipment that are hundreds of thousands of dollars, It's just like, and then you look at obviously another office, and I'm at a place where I've got 4 children that are very busy, and they have a very, they love their life because of my wife and I have made it to where it's very secure for them. And I would hate to buy all in into or jump all in into a new therapy, new clinic that basically drains me, drains the office, and then we're left doing something different. So
yeah. Well, your kids are only kids once, so you have to enjoy it every day.
You told me that.
Yeah,
you're exactly right. And that's another thing too, is that I can work 100 hours a week. I'm at a place that I don't want to do that anymore. Miss out on a very important time. I have all girls, and so they need their daddy. And so I don't want to be absent or even nearly what I would consider omnipresent. So, and sometimes when I've got a lot of work hanging over my head and my shoulders, I can put my nose down and I can forget about what's going on around me. So,
yeah. No, I hear you about the kiddos. Like I said, mine's 21 now, and he's blown his ACL 2 years in a row. He wants to play lacrosse his last season. And I said,
same ACL?
yeah,
Oh,
yeah,
man.
yeah. It's unfortunate, but he's doing a really good job with his rehab right now, which is good. He'll be able to play. But I said, do you think I can come and watch your first practice? And he goes, what do you got to do that for? And I said, because you're only my kid once in a while. I didn't get to see him for 2 years to play. So enjoy it while you can, when they're there. You can always be a chiropractor, but you can't always be a dad with little kids or, teenage kids as they grow. So I'd love to hear a success story of, a patient that you could share, whether it's in the functional side or, sports side, but, share a success story with us if you could.
On the sports side, I mean, it's probably the reason why I continue doing so much of the functional, the nutrition, that side of health, because I truly love helping people in a hopeless moment. And I think with sports injuries, it's very mechanical. You got the biomechanics, you've got a nutritional and hormonal component to healing and of the soft tissues and things like that. But it's pretty predictable. The point is when you get on to when some things are hormonal, things are metabolic, things are inflammatory, whatever it might be, genetic. I mean, it's there's a lot of external factors that limit or improve the overall outcome. And I can't remember if I discussed this with you before, but I sometimes when I go speak and I go lecture in places and people ask this exact same question. They want to know kind of what are the cool things that I see in the office? What are some cases that I see all the time? There's not one specific thing that I see, and that's all I see. Mm-hmm. I do like keeping my mind, refreshed and learning new things and taking on new cases that are kind of adaptive. But it for me, I think when I tell people, it's definitely fertility. Yeah, because, when you see a female, especially when she's in her mid to late 30s, been married for 8 or 9, 10 years, and they've gone through fertility clinics. They have either not found out all the information that they can find out, but they've been stuck to, again, standard of care. It's the same regimented hormone approach. They go through the same procedures because that's the standard of care for fertility. The problem is that infertility and hormonal imbalances are caused by a multitude of different factors. And so when you just happen to dig a little deeper or take a little bit different approach, maybe even look at how the body is metabolizing hormones, like we use a Dutch test a lot for that, right? Yeah. So I may implement some changes versus what I see in a serum test. Well, I'll do a serum test on day 17 to 19, and I'll do a Dutch day 20, 21. And I'm looking at how the body, what the serum was producing that day, but I'm also looking 4 or 5 days later, how the liver has metabolized those hormones. And so it's going to give me a better picture of, okay, why is the hypothalamic response and the pituitary seeing it this way? And so I may throw a few things at it that are super simple, like just some simple B vitamins, for instance. And I won't go into like the numbers and detail, all that kind of stuff, but let's just say that. And we may add some, and I might do some genetic testing, find out, yes, they've got not only just MTHFR, like one of the two and a mutation here or there, whatever. Mm-hmm. They may have a multitude of methylation insufficiencies or catecholomethylene transferase. They have COMT issues, whatever it might be. And I might add a few things to improve the estrogen progesterone balance. And it's maybe a little different than what they've done. So they're not taking a hormone, they're not doing anything. And it's just something that's maybe, hey, this can't be this simple, right? So it takes the stress down on them a little bit. And then all of a sudden, in 2 or 3 months, I get a phone call or we get an email and they got one that stuck naturally. Yeah. And they tried everything. They spent all this money, and maybe it was the calming effect. Maybe it was definitely improving phase 1, phase 2 liver metabolism, whatever it is. The point is that those phone calls and those emails, or even when they come back in, especially after they've had a successful birth, and again, even more so than when they get to have the natural birth that they want. Yeah. Those are the coolest things because you're giving that family everything that they ever wanted. Mm-hmm. And it's a forever blessing that they get to see every day, witness to every day, talk to other people about the struggles that they had. I mean, you can probably tell it does make me a little emotional,
Absolutely.
And and because my own wife dealt with some of the same stuff. We've lost a couple out of the 4 that we have. We lost a couple, and it was hard for her. And I sympathize with women that do lose either a multitude of pregnancies or lose a child. It's a very hard place to live. It's a hard place to be because their body is built to do that one thing. That's the one thing. They would trade tens of millions of dollars. They'll trade everything in the world for that one thing. And being able to give them that or be a part of the story. Again, it's not me doing it. It's him. So the point is that being able to be a part of that story is very rewarding.
Yeah.
Very rewarding. And I think that those are the ones that that we get that, that I feel like that are the most enjoyable.
Yeah. So I can only imagine my wife and I did in vitro fertilization. We were very, very blessed that this is 22 years ago that it took place. My wife's a type 1 diabetic. She was high risk. We were both in our 30s. So everything was going against you. It was a costly issue even back then, and it's even worse now. And they're trying to just dump as many eggs in at the time, which is maybe not the best way to go, but I'm not a doctor in that position. But you're exactly right. People just don't know what emotional roller coasters it goes on. And me as a dad, a man, it was tough. But my wife going through that and injecting her every time, and then knowing, like, we have our son's first image, which is him in a dish. That's like our first photo of our son. And it is the greatest blessing. And I can only imagine on your end, I know you're not taking credit for it, but you played a part. We don't know exactly what part that is, but I can only imagine how good that does make you feel when you get to hear those good parts. Having a kid that goes through ACL rehab is great. They get to go back and play a sport, but having the ability to affect a family, build a family, that's different. Yeah. That's different. So good for you. And it's from the man upstairs. My faith wasn't as strong as then, but he's been a blessing to us twice. He not only was an in vitro baby, but he came 9 weeks early. So he was 3 pounds, 5 ounces.
Wow.
He sat there for 6 weeks. So we were
super high risk.
Yeah. We were very blessed to do that.
Wow.
So I want to share all of your links because you've got too much. You're not a good old chiro. I want to say you have too much that's to you that more people need to know about you. So I'll share all your links. Where would you like, if people want to learn more about you, Dr. Banks, where would you like them to reach out to you?
They could go to www.finish and the numeral 1. That's finish1.net. That's the easiest place. You can also use some of the actual links there. That's text message system to our office staff. Okay. That way, that's probably the easiest way for communication. And that's where actually a lot of our patients do communicate with us. So, or you can send an email to info@finish1.net. And then any of our staff can get back to you that way.
Cool. I'll make sure to share those links for sure. 2 last questions here for you, Dr. Banks, if you can. If you could give us one piece of advice that would put everybody's health in a better positive direction, what would that advice be?
Think about sleep hygiene. I think most people don't realize just how impactful quality sleep is. Too many times we try to get everything done by the end of the day, and there's just not enough time in the day. And so whenever our head hits the pillow, whenever that is, however we do it, we just do it. Instead of actually pre-planning sleep and trying to get sleep efficiency, sleep quality, and thinking about sleep no different than if the next day that you're fixing to go to the gym and thinking about your fitness, you're thinking about your workout, you're getting your bag ready, you're getting maybe your water bottle ready, setting out your supplements, whatever you might do. That takes time, and you're planning for that. And also you're scheduling everything around that so you can get it in. We need to do the same thing for our sleep. And too many times, especially in our age that we're at right now, we're just busy grinding, working, that kind of stuff. And gosh, all of a sudden you look down, it's 10:45. It's like, it's time to go to bed. And you might have snacked all the way to like 9 or 10. So I really try to make people prioritize their sleep and sleep quality. So I have them do certain things, 3 hours before going to bed, 2 hours going to bed, 1 hour before going to bed, and getting them to understand that within 15 to 30 minutes of this window, you should be in your bed. 15 to 30 minutes, you should be waking up. And that 15 to 30 minutes should hit that window on both sides 7 days a week. That improving the circadian rhythm has a carryover effect to other hormones, which there has a carryover effect to how your body responds to inflammation. So the point is that sleep is the most free. It does not cost you anything. And if you can start prioritizing it, it will save you a lot of time and a lot of money and a lot of heartache and headaches when you can get it right. And if you try all those things and you're still not sleeping, that's where somebody like myself would come in and figure out why it's not as efficient as we want it to be.
All right. Well, after that statement, I will make sure not to tell you what my sleeping habits are like. They need to improve. So for sure after that. Thanks for sharing that, Doc. Last question. You're on the Prime Health podcast. What is your definition of Prime Health?
Being just like I do for my patients, I'm their advocate. I want people to be their own advocate. Learning about health, learning about their body. What does it feel like to not be optimal? To understand, what it feels like if you do a set of labs, for instance, and you see some markers that are not quite in the ideal range. What does it feel like when your vitamin D levels are at 25? What does it feel like when your vitamin B12 is like at 350? What is it doing to your body when those are like that? So learning about those understandings of body awareness is very critical. And then being able to apply maybe some dietary changes to those things, maybe just some simple time, just getting outside a little bit more, what it's like to kind of decompress, de-stress, being an advocate for yourself, for your body, and for your body systems. You don't have to go all in and spend a whole lot of money, but just knowing exactly, being aware of what your body is experiencing and feeling. If you're not having a bowel movement every day, we got to figure out why. So the point is that being your own advocate versus either if you're somebody that sacrifices themselves for everybody else, that's not good. Eventually you're not going to be good for yourself. You can't be good for everybody else. Women and mothers are notorious for doing this. Mm-hmm. So learning a little bit more about your body and being your own advocate for yourself, for your family, through your physicians, through your friends, and holding yourself accountable. I think by doing that and staying consistent with those things, you can definitely optimize your overall health and longevity.
Well, I love all of the podcasts, Dr. Banks. This is great. At the end, I get to learn. For me, it's selfish. It's for everybody else as well, but it's selfish for me. I get to learn, the intelligence of it. So I really appreciate the time that you took with me. You have an extremely unique perspective. I'm a chiropractor, you're a chiropractor. All too often, I don't think that we get enough credit for what we know and how we can work with other people, and exactly. How much we care for patients. And that's unfortunate. If you don't think that just means that you're ignorant, you're not giving the chance. Just like there's a bad chiro, there's a bad PT, and there's a bad doctor. They're all out there. Right. Search for the good ones. You're one of the good ones. That's evident from this conversation. So I always tell people that when you listen to this podcast, if there's just one person that can take a benefit from this, please do share it. We'd love you to share it as many people as you can. Always share our podcast. Selfishly, of course, subscribe and share all that kind of stuff. But when there's somebody that can hear what Dr. Banks had to say, and he talked about athletes and women and, so many other things that are important, sleep, that can actually help improve your lifestyle, it's important for you to share that information. So again, I appreciate you taking the time out of your day. I know you got to run to be with the kiddos. So it's good, and as I said, please subscribe. But until next time, remember that life is a journey we're all on together, especially when it's a true wellness journey. So whether you're taking charge of your own health or guiding others in theirs, every step forward matters. So I always say, please do stay committed to your Prime Health journey. And again, Dr. Banks, thank you very much for being a guest on the Prime Health Podcast.